So, lifestyle change, we say it's a key to public health. What is the problem? This is a quote from Professor Wiseman, the medical and scientific advisor from the World Cancer Research Fund. You can see this if you go to the link there. We're now more sure than ever before that by limiting the amount of alcohol they drink, maintaining a healthy weight and being physically active, women can make a significant difference to their risk. We estimate that over 40% of breast cancer cases in the UK could be prevented just by making these relatively straightforward changes. And it's that issue that these are relatively straightforward changes, but we can see from the evidence that people aren't making relatively straightforward changes in relation to alcohol drinking, weight management, and physical activity. So how we can engage with health professionals and with the public in encouraging and understanding that risk, that change process is key to what we need to do. And we know we've heard from other speakers this morning, it's the key challenge for the 21st century. And what do we need to do? I mean, we've had health promotion for many years, and one of the issues I'm going to talk about on food safety, there's been a lot of health promotion regarding a particular issue with food poisoning, and it hasn't really worked. So do we need to reduce the focus on the education of the public and public information in the way we do it at the moment? And find new ways of engaging with the public. Do we need to have more? Well, we need to have reliable measures of lifestyle activity. We need to understand the impact that some of these lifestyle changes do have long term on people's health. And we need to understand the impact of these lifestyle changes over the life course. Because, as has been said already, things people are doing now will be affecting their health in 20, 30, 40 years' time. We need to understand a little bit more about how, and this comes down again, links back to education and public information, something about the role of risk perception, how people feel about risk, how people feel about the control they have over those risks, and therefore whether they have any illusion of control and can make changes that will have any impact. And we need to look at how the environment plays in with lifestyle change, so the whole issue of healthy cities, how we can help people in becoming more active in adopting healthy lifestyles. And also, I have a strong belief that we have policy changes that occur rather rapidly because there are people in post for 2.5 years, as we heard earlier. We have rapid change of interventions and then a decision that things aren't working without proper long-term evaluation of some of these interventions. We are talking about life course, so some of the things we need to understand how things are working over a longer period of time. What do we feel our strength in our contribution from Europe? Our strength is that we have a potential for collaboration. So we can bring healthcare professionals in nutrition and dietetics and get them to work with health psychologists. We can have biomedical scientists working with nutritionists, working with exercise, sport physiologists, working with people in the environmental health area, looking at healthy cities. So we have a strength in this multidisciplinary approach, and I think that we have a lot of professionals who work in the area of understanding the process change and change in processes. So if you look at biomedical science, we can measure the impact of lifestyle change, looking at the cellular response, tissue response, whole organism response. If you want to look at some of the physiological responses, we can look at psychological measures of lifestyle change. We've got experts who can look at risk perception and relating to change, and we have people who are able to develop reliable, valid measures. So a colleague of mine was involved in the development of the fast alcohol screen, which is one that's recommended as a tool to be used to determine an intervention strategy for alcohol reduction. And we have spent many years developing and evaluating a number of interventions.